Dr. Donna Gurley, and today we'll look at the public health system in the United States. This presentation was initially prepared by CDC in 2013 as a stakeholder training resource. I've modified it for today's presentation. In 1994, this statement was developed by the Public Health Steering Committee. It provides a vision and a mission for public health, as well as the context of what public health should be prepared to do and how services are delivered. The vision for public health is broad: healthy people in healthy communities. The mission is to promote physical, mental, and I would add spiritual health, and prevent disease, injury, and disability. These are lofty goals for the citizens and residents of our country. Let's look at how these goals can be implemented. From the previous century, the average life expectancy in the U.S. increased by more than 30 years. Public health improvements are credited for 25 of those years. Some of these public health achievements include making workplaces safer, improving food and drinking water sanitation, and implementing vaccinations which controlled many infectious diseases. The foundation for public health lies within the three core functions of assessment, policy development, and assurance. These were further developed into the 10 essential public health services in 1994 and implemented at the various levels of the U.S. government. In order to improve the performance of public health and the corresponding outcomes, several key components need to be implemented. Starting on the left, investments in the public health department and the public health system, including developing the workforce, builds operational capacity and infrastructure. This infrastructure impacts all community programs and public health activities and leads to better health outcomes, reduced disparities, and enhanced preparedness to meet public health challenges. Investments in the three core functions of public health lead to big dividends in the form of improved public health outcomes. With these goals in place, let's look at how public health services are organized within the U.S. government. There are various levels of governmental agencies that implement public health services, including state health departments, tribal health departments for Native Americans, local health departments, which are typically found at the county and even city levels, and territorial health departments for the U.S. territories, including Puerto Rico, Guam, and other islands. These governmental departments were given the primary responsibility for public health from the U.S. Constitution, the policy document which founded this country. You can see from the numbers that the vast majority of public health agencies are found at the local level, with the states taking more of an oversight and reporting roles. These numbers are listed at the top of the cylinders. The divisions which we just saw report up through the states to the federal public health agencies like the Centers for Disease Control and Prevention, or CDC. These national agencies have large overarching responsibilities which you can see listed here. I'll highlight two of them. The second bullet is act when health threats may span more than one state, a region, or the entire nation. A good example would be an event that impacts more than one state, like a hurricane. The fourth bullet is act to assist states when they lack the expertise or resources to effectively respond in a public health emergency. An example of this would be an emerging infectious disease where little is known about the cause or spread of the infectious agent. A A recent example was the outbreak of the Zika virus. Although this occurred outside the U.S., the CDC was not only monitoring, but also assisting these countries in the identification of the virus, how it spread, and the morbidity and mortality rates. Other public health responsibilities of the federal government include providing leadership in setting the public health agenda, giving resources, both financial and operational, and supporting the development of technology to improve public health at all levels. State health departments have very different roles from the federal government. These responsibilities include screening, such as newborn screening, HIV/AIDS, tuberculosis, and diabetes, treatment, such as tuberculosis, sexually transmittable diseases, and HIV/AIDS, technical assistance and training for emergency responders, hospitals, data management, and policy development, state laboratory services for testing of bioterrorism agents, foodborne illness, influenza typing, environmental toxins, and newborn screening, epidemiology and surveillance, such as data collection and epidemiology of communicable or infectious diseases, vital statistics, and chronic diseases. This chart displays the various sources of funding to state health agencies across the U.S. In 2011, the largest source of state public health revenue was federal funds, followed by state general funds or tax dollars. Now let's look at how local public health agencies are organized across the U.S. Each local health department is organized as one of these system models. A local health department that is led by its local government is referred to as a decentralized model. A mixed model means that there are different models within the same state. Some local departments are led by the state and others are led by local government. Sometimes this occurs when a smaller county lacks resources and contracts within the state to provide these services. If a local health department is a unit of the state government, this is a centralized model. And local health departments that are governed by both the state and local authorities are called a shared system. This map indicates which states organize and govern local health departments. Green states are local or decentralized. Gray states are mixed. Yellow states are centralized. And only 3 states are red, which are shared governance. Based on this map, the majority of states are organized which way? Can you think of a problem that might occur with states governed differently for public health services? Would the yellow states be better organized and more efficient than the red states? So just some questions to consider. The top 10 most frequent services provided by local health departments are listed here. These include activities centered around preventing infectious disease outbreaks and surveillance of environmental hazards. However, even with the food safety program, which permits and inspects eating establishments and trains food handlers, there are still an estimated 48 million cases of foodborne illnesses each year in the United States. Does this mean that the program isn't working effectively? Well, what if the food safety program didn't exist? Do you think the number of foodborne illness cases would increase or decrease? This graphic shows the sources of funding for local health departments. Compared to the state funding sources, counties obtain most of their funding through local fees and taxes, followed by state and federal dollars. Now, let's look at how public health is organized for Native Americans. A number of organizations work together to deliver health services to these indigenous groups. A tribal health department, a health department, corporation, or organization operated under the jurisdiction of a federally recognized tribe or association of federally recognized tribes, and funded by the tribes and/or contracts services from the Federal Indian Health Service. A tribal health organization includes tribal health departments, Indian Health Service units, area Indian health boards, and urban Indian health centers. Government is not alone in developing, designing, or delivering public health. It takes a village. Many different types of organizations participate to improve health within our communities. The goal is a system of partnerships that interact collaboratively and effectively with all levels of governmental public health and each other. This graphic depicts how non-governmental organizations collaborate with the public health agency to ensure health for all. Each of these organizations plays a role in improving the public's health. Collaboration happens at all levels to deliver and ensure health. These include partnerships, effective communication, overarching health objectives, sharing resources rather than competing for them, leadership provided by the governmental agency, and feedback from all partners. I hope you can see how public health is a very diverse, interconnected network of partnerships that work together to ensure health for everyone. I'm Dr. Donna Gurley, and thanks for watching.